Good afternoon, everybody. Welcome to Lifestyle with Dr. Mobi. I'm Dr. Mobi, and today we have great guest, and that is Dr. Jamil with us. And today we are gonna talk about gray hair. Yes, you heard it right. Gray hair, which is a common problem, and a lot of people want to know why we have gray hair. Guess what? We have a specialist with us, and he's gonna discuss and talk about a lot of things, why we get gray hairs and what is premature and what is the best way to handle all this. So with this, let's welcome Dr. Jamil. Hello, Dr. Jamil.
Hello, this is Jamil Ahmed, and thank you, Dr. Mobi, for inviting me to talk about this interesting topic, the gray hair. You know, we heard a term called silver fox. It means an attractive man. The term has been used for 100 years, and we know that almost all adult has a gray hair, and it starts very early. The similar term has been used for female too, called silver vixen. At one time, this term has been a bad thing to say about female. It means cunning and unpleasant, angry. But now the term has been changed to something more complimentary called attractive woman. Someone says, I don't have gray hair, I have wisdom highlights. I think that's how probably we should take this thing as the time goes on with our life, and most of our will be having some gray hair as expected.
Also, Dr. Jamil, I want to ask you, what is premature graying of hair and why people develop that? And thank you for giving that excellent explanation.
Leaving jokes aside, so why do we have gray hair? It is a hereditary thing, or it runs in the family. And there are some reasons that we can have gray hair, like stress, or sometimes you have a family history of gray hair and you under stress, then you tend to have more gray hair. There is an interesting saying is that gray hair is hereditary. We got it from our children. It may be partly true. There are some conditions like B12 deficiency, thyroid problem, vitiligo is an autoimmune disease that makes your skin white, or you lose your pigment. Neurofibromatosis is a tumor that runs along the nerve. Tuberous sclerosis, an uncommon tumor in different organs. It is benign. Then other common things that we can think of is vitamin C deficiency, iron deficiency, biotin deficiency. And if you are a smoker, you have 4 times the risk of having a gray hair. So it is something to watch for, probably should stop smoking when you are very early.
Yes, Dr. Jamil, also please tell us about why do we get gray hair?
Premature graying of hair. As we get older, we all gonna get gray hair. The premature graying of hair also depends on the race you belong to. If you're Caucasian, it usually starts below age 20. If you're African American, it is around 30 year. And for Asian, there's no real number, but you expect to be around 25 years. And it's all because of hair follicle that produce the pigment. I can name a lot of important people or famous people who had premature gray hair. Marilyn Streep, Diana Keaton, you all heard of her. Lady Gaga, George Clooney, and Morgan Freeman, to name few. So it is nothing to be worried about because it is a genetic and you expect that to happen to everybody. So what we can do if you start seeing some gray hair here and there, if you are interested, you can do a few things to find out whether you have any disease that causing premature gray hair. Most of the time there is no pathology. It is a natural progression. But you can do some blood work. That should include some B12 level, folic acid level, and thyroid level. And you can see a dermatologist if that bothers you. And usually the treatment options they will give are not satisfactory. If you have less than 10% of your hair gray, then you can do plucking of the hair as an option. And it's true that plucking of the hair will not make your hair any grayer. Then comes the usual things like a hair dye. And you can buy some store brands. And there's a natural hair dye that you can use. They call Indian gooseberry, henna, false daisy, and lotus tree. It works somewhat. But store brands are strong and works pretty fast. There's a thing called B5, calcium pentatonate. It's a 200 milligram tablet sold as an outpatient, over the counter, and it works somehow. PABA, P-amino benzoic acid, 200 milligrams supplement works for some people, so it may be tried. There's another medication that been tried called plastoquinone, SKQS, in order to slow down age-related change, including graying of the hair. So if you are really worried about this, then that may be an option.
I want to ask you also about treatments.
Growth of the hair and the color are two different things. Usually it happens together. Sometimes the hair continues to grow, but coloring mechanism fails. So you still have good hair, but color is grayer. Like everything else in our body, genes dictates everything, including hair color. If possible, avoid stress. Just look at our ex-president Obama. At the time of his inauguration and 8 year in his office, his hair was almost 50% grayer, and that expected with that kind of stressful job. If you are a smoker, don't smoke, because you will have 4 times more incidence of gray hair than other people. For our body to function, you need blood supply. Smoking helps with obstruction. So I think that's how the mechanism is, that smoking makes your hair grayer faster. If you have a problem with B12 deficiency, take supplement. And of course, exercise daily. Few other things I can add. If your gray hair bothers you, you can always dye your hair. There was concern that hair dye is associated with non-Hodgkin's lymphoma and leukemia in some report, but not in others. It's possible these dye companies or hair dye companies changed the formulation, and that helped. But there is incidence of increased bladder cancer among hairdresser and also in the barber. Even the hair straightener can cause breast cancer. So graying of the hair is natural, and if you want to be happy with that, that's fine. But if you are not happy, then you can use hair dye, and I think it's safe.
And any final thoughts you have about this subject?
Let's talk about some boring things like how we get color in our hair. Color is a pigment, and that has been created in our body from the skin, a cell called melanocyte. There is two things. They call eumelanin and pheomelanin. Eumelanin causes black and brown hair, and pheomelanin causes reddish brown, reddish yellow, and ratio of different pigment can give you different color, like black, brown, blonde, red, gray is the basic color, and there is some variation to these things, and because of the how much you have eumelanin versus pheomelanin. People live in a sunny environment or tropic area are usually gets dark skin and darker hair, as ultraviolet ray from the sun stimulates eumelanin. But in Caucasian, it is just opposite, because they have more pheomelanin. I can give you a barrage of different color of the skin, of the hair. It's like a chestnut brown, auburn hair, a part of red hair, ginger red, copper red, Tahitian red, and strawberry blonde. So there is a varieties of color in European descent, but in Asian descent it is usually black.
And in the end, thank you for watching our show. It's been pleasure always, Dr. Jamil, for giving this kind of informative shows. Take care and keep watching Lifestyle with Dr. Mobi.
Thank you very much.